My name is Hannah and I am an Operating Department Practitioner, or an ODP as we are more commonly known. But if you have never heard of us, I won't be surprised because not a lot of people have heard of us. So I work at the Princess Alexandra Hospital NHS Trust, and I specifically work in theatres. We have around 11 or 12 theatres here, and we cover main theatres, a day unit theatres, and maternity theatres. So, a day in the life of an ODP, there are 3 areas within theatres that an ODP can work. So, you can work in 1 or 2 or all 3 of the areas. You can choose to do them all, or you can specialise in one area. So, the 3 areas are anaesthetics, scrub, and recovery. So if you work in anaesthetics, you will be preparing the patient for their anaesthetic, so being put to sleep for their procedure, and you will be reassuring them, because often patients are quite anxious because it is the whole idea of being put to sleep, not really know what's going on, it's the unknown, and you do really have to be there for them and, you know, tell them that you are going to look after them and you're going to do the best for them, and, you know, it's going to be okay. We have expert knowledge and training of airway management, because when you are put to sleep for a procedure, we need to pop an airway into the patient's throat to breathe for them. And we also have excellent knowledge about drugs and pharmaceuticals, because obviously drugs are required to put patients to sleep, and we use drugs to help monitor and support the patient's heart rate, blood pressure, and all things like that. So we are also responsible for checking and maintaining specialised equipment, like our anaesthetic machines, which are used as ventilators while people are asleep. We also have lots of other specialised equipment, but I could be here all day talking about them. If you work on the scrub side, you will be getting all sterile with your gowns and your gloves, and you will be dealing with all of the surgical instruments, working with the surgeon and your team of other people. So when they ask, for scalpel, you give them the right instrument at the right time, and you are responsible for all of the instruments, the swabs, the sharps, and you are accountable to know where they are at all times and that all the counts are correct, so that nothing gets left in the patient at the end of the procedure. And if you work in recovery, it's after the operation has finished, and it's when you're waking the patient up, you're making sure that everything is safe, you're making sure that the patient recovers well, and it's transitioning back from their procedure to then either going home or going to the ward, because they're then going to have an inpatient stay. So a recap, because I've given you quite a lot of information about what an ODP can do, and I understand that this might be the first time you're hearing of what an ODP is. So we predominantly work in theatres, either on anaesthetics, on scrub, or in recovery. And since the pandemic, the COVID-19 pandemic, it has become well known of how transferable an ODP skills are to other areas. So as quite recently, ODPs have been branching out to both ITU and to A&E and to other areas. It is a 3-year degree at university, and where you will study quite a lot of topics within this degree, as pharmacology, anatomy and physiology, ethics about healthcare, and loads of things like that. It is a very, very rewarding job, but you will be prepared to work very hard, and every day is different. No day is the same.